20 OSCEs of 5 marks each, which will lead to your 100 marks. Okay, अब जो remaining 200 marks है, total is of 300 marks, and we have to score 150 out of 300 to pass the exam. 1 point. Second thing, apart from this, you will be having 2 clinical cases. And then after that, what they say that there is ward round for 40 marks and something called as Viva was करके for 60 marks. Okay, so we have to gain at least 150 out of 300 to pass. Okay, so my motive, like what I would like to suggest you guys is like out of 100, है ना, जो 100 का this thing is there of our OSCE is there. इसमें important time is the timer. I'll like during the classes and during the further sessions, I'll keep on emphasizing on this point that timer is the thing which will make you do mistake, make you do wrong things because of the pressure which is there. 1. And you will see it in the coming OSCEs also. Why it is being said. 1. Second thing is the case. Okay. So this case discussion, it is again of 100 marks. Invariably 90 to 95% of you people will get case of COMS commerce. After that, you can get either thyroid or you can get some malignancy such as CO oral cavity or larynx. Mota. And like I like 1% people will still be there who will get some ectopic cases, but that is like out of the scope. And remaining jo 100 marks hai, these are depending upon the institute you are going to give your exam. They might put some 4 table viva, they might put some tables. What happened in my exam, it was like that there was 1 table for otology, 1 table for analogy, 1 table for head and neck, and 1 table for recent advances. People change it. What I saw in the last session, there was 1 table for radiology, 1 table for instruments, which was not there in my exam. Okay, so these things will keep on changing. So we will during the entire syllabus of another 1.5 months to 2 months, we'll go through all these things, and believe me, you'll have we'll go through the entire syllabus at least twice, thrice, whatever is required for us to gain those 150 plus marks, and you'll still have at least 2 to 3 weeks to revise it comfortably. 2 books which you should go. One is your Scott Brown. Okay, you go through that one. I'll try to complete all the images which are given in Scott Brown. Just stay hanging around, है ना? And second thing is, apart from Scott Brown, is your Lalwani. Okay. What I have prepared this is my 4th session. Last session I had around 50 plus candidates, and those who were there in the last session know it, and it has a good success rate, which I'll say it is a very decent. ENT passing percentage in my institution was around 30-40%, and like if you're saying out of 50 candidates, around 30 plus 40 plus who are giving their exams are passing, it's a good percentage. Okay, 2. Now, I would like to introduce myself. I am Dr. Shubhankar Tiwari, and I did my DNB from Base Hospital, Delhi. And after that, I moved out to another place in Uttar Pradesh called Bareilly. And I was having lots and lots of time during the evening. So I tried to put whatever I had studied and in a simpler format, in a resident-friendly format. And why I am saying it, you'll realize it in the coming days. Chalo, abhi baki keeping the things apart, we'll start with the classes. This is the first question for the day. Okay, see the image given. Acha, one more thing, bhai. One more thing is that it could have been more easier for me if I had gone through that PPT wala format. है ना? कि you come with the PPT, already made PPT, thak, PPT over. Now you also go to sleep, I'll also go to sleep. But according to me, it's not a very good way to interact like that. So I'll request all of you, we are around 25 of us together. Nobody knows each other. Okay, so even if you answer wrong, there is not any important thing about it. It's better to answer wrong here than to answer wrongly on your Viva day. Getting my point? So I'll request everybody, just try to join in the conversation. I'll keep on taking your names. I've already saved your names. And one more good thing is that so we'll see it in the further things. Now, see the image given below and answer the following questions. We all know that this image is of laser. There is no fun in telling that this image is of. So we have no fun in telling that this image is of laser. Okay, we all have studied laser from different books during our preparation of exams. So what is fluence threshold? Okay, so I would like to answer this thing myself, that what is fluence threshold. Basically what happens that this is how it is defined, that measurement of lowest energy level at which tissues begin to vaporize. Okay, so I'll just write it, measurement at which tissue begin to vaporize. ठीक है. Now what is laser safety? So laser safety is a easy question. I'll just request, can somebody unmute and try to take it, what all 2-3 points you will answer in your viva. What is laser safety? Anybody? I know in medical education nobody volunteers. Even I also didn't volunteer in my residency days. ठीक है. But just imagine you are being asked it on the viva day. How will you approach this question? Anybody?
So shine outside the OT and use of laser safety goggles and change of material of
Great.
gowns for surgeons as well as patients.
So definitely you have answered to around 3 to 4 things out of them. So we are through with this question, that ये एक number का question होगा, what is laser safety, है ना? So you have to answer around 3 to 4 points in a point wise format, है ना? And we'll move ahead. Okay, what is the answer exactly? I've mentioned it at the end of this question. Okay, exact what is there in Scott Brown. Okay, now name 2 uses of lasers in ENT. Just a minute. ठीक है. So after these 2 questions, then we have what is laser safety हो गया, name 2 uses of lasers in ENT. So we are well versed with these type of uses, है ना, कि we use it in stapes surgery, in various other larynx procedures we all use, in various nodules we use. So we are through with this answer. Okay, so now when the anything about laser comes, okay, so photo of this gentleman will appear in your should appear in your mind. Now why should it appear in your mind? Can somebody take a try? कौन है ये भाई साहब? Something related to CO2 laser. Now take a try, somebody. Either like by name you will sound Gujarati. Somebody? No? Chalo, I'll take it. है ना? So name of this Dr. Saab is Kumar Patel. C. Kumar Patel. Okay. So there are very few places जहाँ पे you will find Indians taking the lead. Okay. So he is associated with the advent of CO2 laser. Okay. Now one more question associated with CO2 laser. Uses we all are through with that. What is the wavelength of CO2 laser? Now can somebody take it a try?
10,600 sir.
हाँ, 10,600. And इसके बाद आगे क्या लिखेंगे? This is very important.
Nanometers.
Nanometer. So please don't forget once it and all इसको लिख लो. अगर if you write 10,600 तो एक नंबर में से आधा नंबर मिलेगा, आधा नंबर चला जाएगा, है ना? So we have to aim for that complete 1 marks. This unit is also important. Okay? So please write it completely in toto. चलो आगे बढ़ते हैं. Don't forget it. This will come for at least 10 times during the whole month. Okay, so please don't forget. Okay, now what all things were related to this type of image, laser and associated things, I've tried to compile it in a single 2-3 pages. I'll just go through that. So this is your laser safety tube. You can see the double cuff over here. Okay, so what was initially Dr. Saab said about laser safety, है ना? All of this is given point wise format. Please go through it. This is important, है ना? This shouldn't be that वहाँ पे जाके goof up हो, you are not able to speak only, you are saying only 1 point, 2 point. So that shouldn't be done. It should start right that sir after in front of the OT there should be a symbol that laser procedure is going on, and वहाँ से लेकर के अंदर तक पूरा you should be well versed. So all given in point wise format too. Going through this again, what all questions, other questions can be there? I'll just increase it. This is the Norton's tube. Just see, it's a laser resistant tracheal tube. Okay. There's one more tube where the image which we saw, the name is Mallinckrodt laser tube. Okay. 2 question हो गए. आगे चलते हैं. ET tube से related, there are 2 more questions. Why is this? What is this this opening chord, this is called as Murphy's eye, and this is a radio opaque line which is there in the endotracheal tube. This is not exactly pertaining to your, just a minute. Okay, so this is not exactly pertaining to your laser question, but these questions can very well be asked from ET tube section. Do ho gaya. Acha. Okay, again one more. This is the similar kind of thing, questions which can be asked. Now, image of laser you all saw. There are certain other images which are there and which can be asked easily. So I'll go through them once. This symbol is for biohazard. Okay, and this is for your radiation. Laser we already saw, and this is for cytotoxic waste. Okay, there are two things they can ask you. Active and passive voice hota hai na, they can give you the image and ask you what does it stand for, or they can also tell you ki draw the symbol for laser, draw the symbol for biohazard. So keep it in your mind, it is important. Okay, don't lose on it. Okay, so after this one topic, after one topic I'll come to another important favorite topic of DNB, which is called as, answer kya hoga is question ka, I'll just read it and then I'll tell you. A 45-year-old male patient presented to OPD with complaints of impaired hearing in right ear, listening to his own footfall, transient vertigo, disbalance while walking, HRCT temporal bone, blah 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 blah. Answer is, first is, पहले तो diagnosis पकड़ लें, answer तो पता है हमको, क्या answer होगा?
Superior semicircular canal dehiscence.
Superior semicircular canal dehiscence syndrome, also called as third window syndrome. Okay, acha. Now, why I was telling you that why this thing is important? Can you see what is there on this right corner? This thing, this color. Can you see the time? Okay. Now, what happens is when you will start reading this question. Okay, when you will start reading this question, when you will see this image is as it is from the which came in the DNB. Okay, you all could can make it out. Okay, so till the time you have read your question, you have seen your image. So this time, जो 4 minutes से शुरू होता है, it will start decreasing, thak 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 thak, and that till the time you reach here, it will have already gone till 2 minutes 30 seconds. So this is the thing जहाँ से panic शुरू होता है, जहाँ से you people will start panicking, है ना, कि यार I'll make mistake, time is about to end. So because of these type of things, you need practice. Now let's go ahead.
Excuse me, sir. Excuse me.
जी बताइए. हाँ, please.
Excuse me, sir.
हाँ.
Sir, I'm not able to see your display.
You're not able to see?
I'm not able to see the display, sir.
Okay, anybody else is having this problem, or only Dr. Nishma is having this problem? Just a minute. Hi, anybody else is having this problem?
No, sir.
No. Then Dr. Sahab, I'll just request कि एक बार आप log out करके दोबारा log in कर लीजिए. Try it out. I'll wait over here.
Okay, sir.
है ना? I'll wait.
Okay, sir.
Fine. चलो. अभी is it visible?
Yes, sir.
Yes, sir. Okay. So let's go to the first question. What is the gold standard investigation for identification of the case? And the answer goes as, can somebody help me out? What should be the answer? हाँ, बिल्कुल. Be confident. I had lots and lots of confusion what to answer. Whether shall I write VAMP over here or shall I write HRCT? But HRCT बिना doubt के लिखना है. This is the important thing. Okay. Second, what is the type of hearing loss seen in the patient? We all can say it's conductive hearing loss. No, there is no fun in telling. Which vestibular function test is diagnostic of this condition? There is no fun in telling. कौन सा होता है? VAMP. है ना? Always remember the full form of VAMP. We'll see the two types of VAMP, that is your cervical as well as the ocular VAMP. So in the subsequent things, we will see according to that. It's important. VAMP भी important है. Now coming to this thing. What is the full form of Fiesta MRI? This is important. I'll try to answer for you people. I have the answer with me. The full form of Fiesta is fast imaging employing steady state acquisition. Okay, and name any two surgical procedures for its management. So the technique which is given in Scott Brown is Lorne. Whatever you want to pronounce, you can pronounce it, but the spelling should be same. Occlusion, and apart from that, there is round window plugging, which they have mentioned. Okay, they have mentioned it capping and resurfacing of it. Whatever you want, you can answer. Okay, so are we good to go with this question? It's very important. This has been repeated twice in the last 5 sessions. Same question. I'll share 2-3 images with you people which have been repeated twice in the last 5 sessions. I'm seeing closely 5 sessions which have been going down from the last 2.5 years. एक ये हो गया, एक स्टेपीज इंस्ट्रूमेंट का सर्जरी है, एक अकॉस्टिक न्यूरोमा का इमेज है. These 3 questions have been repeated multiple times. 2 of them we'll see it today only. Okay, so let's go ahead. Okay, so this image is from Scott Brown itself. Okay, so I'll just read out 3 points. First one, HRCT is the gold standard of this. Full form is this, and just see this image. The same image almost which is there in the DNB exam. This page is from your Scott Brown, and I'll tell you, in one single page you are getting 3 marks. And the importance of 3 marks is that you can very well cross the line of 150 marks. You can very well be behind 3 marks, and that thing of ki bhaiya I have to appear again for the practicals remain on you. Okay, so I was telling you ki bhai these 3 marks are very important for you. So that's why any image given in Scott Brown, just go through that. उसके ऊपर नीचे का 2-2 लाइन पढ़ना है ना? And that is the importance of, I'll say, even 1 mark is important. There will be a person who is getting 149 marks, and still that वो 1 marks का grace की वजह से he'll not be able to clear it. So our motto should be to clear the exam at any cost, at any cost, at any cost. After clearing your theory, you'll be getting 3 chances to clear your practical. So it is better, the maximum chances are there in the first. And if not in the first, तो second में सब कुछ clear हो जाएगा. In my last batch, which जिसका result अभी last week आया, in that there were 3 people who had their 3rd attempt somehow, and the level of desperation you can understand. But lucky enough, all 3 of them cleared. Okay, so don't reach till that stage कि आखिरी पे जाकर के मेरे को effort मारना है. This should be the time you have to put all in your effort. Don't wait for the theory exams to come. I'll say, read slowly, half an hour to 1 hour daily. Don't wait for that point कि let DNB say कि भैया 2 हफ्ते बाद exam है, now I'll start studying. Definitely फिर you are bound to make a disaster. चलो let's go to the next question. Okay, easy question. Repeated times, multiple times it's repeated, and potential of being repeated again. Okay, it is having potential of being repeated again. So what if the Dykely diagnosis? Can somebody, thank you, can somebody again unmute and help me out? Acoustic neuroma. You can write anything, but it's better to answer vestibular schwannoma. Okay, you can say CP angle tumor, DD is vestibular schwannoma. Okay, you shouldn't think let somebody else answer. I'll request. See, I'm also a backbencher student, but I was lucky to pass in first attempt. I was not confident that I'll pass. Okay, same thing I apply when I am sitting on the other side of the chair. I don't see you as कि तुम 4 साल पीछे चल रहे हो. This is not done, है ना? You all are colleagues. You will just clear exam and we all become colleagues. Okay, so you have to help out each other. Okay, 2. So keep on answering. So answer goes as vestibular schwannoma. Good. What is the sign which is seen on MRI scan? It is important.
Excuse me, sir.
जी बताइए.
Sir, I'm not able to see your screen, sir.
Okay.
Can I
I'm sorry for the.
again?
हाँ, definitely. Somebody else also having the same problem?
No, sir.
No, na. So Dr. Keshri, I'll request.
Sir, I can see now. Sir, I can see. Sir,
Okay. So like net connection sometimes might vary. So please let me know anytime something happens. Okay. So the answers you all answer correct. This is called as ice cream cone sign. Okay. Answer correct. Number 3. What is the contrast used in this scan? Answer is gadolinium. Gadolinium. Great. Okay. Now, what will be the resultant complication if SRS is attempted in tumors greater than 3 centimeter? Okay. ये देखो, one question they have already answered over here. In another exam they have asked कि what is the size कि जिसमें SRS use कर सकते हैं. So you should say that it should be used in size which is less than 3 centimeter. Okay. So what I wanted to tell you over here is that one more thing. Please don't write this as GD. Okay, please believe me. Three things from my side. One, there should not be no abbreviations. You should write full form. Okay, and two is your date of expiry. What if date of expiry? They'll give you one fine drug and ask you that how will you give this drug to the patient, and वहाँ पे somehow they would have made it visible that expiry date would be given over there. So वहाँ पे you have to write कि since this date is expired, this medicine cannot be given. I know it seems funny, but exam pressure में people are bound to make mistakes. So please remember these two things. But you shouldn't answer GD. You should also write the full form. And third thing which I wanted to tell you is don't leave any question empty. Don't leave empty. What I meant to say about this thing is, like, suppose there are 4 questions. So इसका एक number है, इसका एक number है, इसका एक number है, इसका एक number है. Or might be they would have given 2 over here, something like that. So if you will not answer this question correctly, so you will not get these 2 marks. However, correctly you would have answered the above questions, but full form marks नहीं मिलेगा. And since there are no negative marks per se, you have to answer everything. Make it a habit कि all questions you have to attempt. Don't leave it blank. Okay. So what is meant by this thing? That after this thing, normally what happens कि अगर tumor is more than 3 centimeters in size and you have given it SRS, so post radiotherapy what happens? It can lead to obstructive hydrocephalus and to your 4th ventricular obstruction. So this is the time which you can answer. And after that, what is this failure and pseudo progression? I'll just answer it. See, this is the image which is given in your Scott Brown, which is very like comfortably came in your exam. Second thing, this is a named curve which is there in your Scott Brown. Please remember the name. Okay? The name of this curve is Nelson-Allen curve of growth of your vestibular schwannoma. Please don't forget it. There is one more named curve in your ENT settings. Both of them you will encounter at least 10 times during the next 2 months. And don't forget, जो उसका नाम है Kaplan-Meier curve. Okay? This we will read in biostatistics section. But please remember, this is a very important question. जैसे ही this curve, इस curve का नाम Nelson-Allen curve है. Please see how this Kaplan-Meier curve looks like. Okay, we'll see it again. So this was my first instance, ताकि आपके like your brain should start reconciling. Okay, this is a type of question which can also come. Okay, so both of them you should remember together. What is the difference between SRS and SRT? There is no fun in telling SRS and SRT. SRS में there is a single application. In SRT there is multiple type of application which is there. This is the only one important difference which is there. There is difference between cyber knife and gamma knife. What is the difference between cyber knife and gamma knife? Gamma mein what happens? There is a rigid framework which is applied to the patient. Whereas in cyber knife there is no need. Okay, one. Second thing is, since gamma knife is supposedly older, इसमें हम लोग neck को target नहीं करते. There is no lesion of neck which can be targeted. This only aims at the intracerebral lesions. Whereas in this, neck tumors, spinal tumors can also be taken care of. 2 questions, 2 marks. If it comes of 1 mark, you can easily get full marks over here. Let's go to ahead. What is RIAN? है ना? चलो, किसी ने पढ़ा or this vestibular schwannoma from our Scott Brown? Can somebody take it a track? What is RION? चलो, let me answer it. RION is important. देखो, first thing is it's important. Okay, it is important. Now, answer is radiation induced optic neuropathy. Okay, so what will be the question? What is RION? 1, and second, at what dose of radiation this RION occurs? तो अगला नंबर आपको याद रखना है 8. ठीक है, कि there is some player by the name of Rio जिसकी short number 8 number है. ठीक है, somehow you can remember. ठीक है, if there is radiation exposure of more than 8 grays, there is risk of RION. Okay, so here only I'll just like to mention कि जो SRS होता है, stereotactic radiosurgery, normally it is like 12 to 13 grays उसमें देते हैं. This is the radiation which is there now currently. Okay, and traditionally which was previously given was 16 gray. Both the data are from Scott Brown 8th edition. Okay, you can just have a look also when you revise. Okay, now coming to the next question of the day, that is what is pseudo progression? Can somebody take it a try?
So immediately after radiation, there will be increase in the size of the tumor.
Lovely. Yeah, that is the answer. Following SRS, there is a transient enlargement. Pseudo. This is pseudo means false. Progression means increase. So there is a transient enlargement. The 2 words which you have to focus. This is transient. then enlargement of the tumor followed by stability or decrease after the SRS. So you have answered it correctly, Doctor. Let's go to the another brother of similar question. Identify the condition. What is the screening protocol? What treatment options you have? Blah 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 blah. So answer is clear. Can somebody see? यहाँ पे दिखाई पड़ रहा है. So what is the answer for this question? Can somebody again give it a try? I'm sorry, I'll keep on pushing you people so that you don't sleep off for the next total of 40-45 minutes. Just a minute. Somebody else is also there.
Bilateral vestibular schwannoma.
हाँ, good. So किसमें मिलता है bilateral vestibular schwannoma? NF2. Okay. अरे NF2 ना भाई. MEN2 में there are multiple conditions associated. Neurofibromatosis is a part of it. So see, that's what I'm saying. See, whenever you are studying vestibular schwannoma, right from your natural history of vestibular schwannoma, the chapter in Scott Brown, or might be whatever you have studied, so go it in a sequential form of way. Natural history 1, surgical aspects 2, followed by your neurofibromatosis 3, and then the treatment part. All the 4 of them should go hand in hand. Okay, so you have answered it correctly. NF2 MEN नहीं लिखना, MEN is a syndrome. Okay, so this is how we should learn. This is my advice to all you people, that so if somebody, that's why I keep on answering. If somebody answers something which is not to be said in the exam, other 20 people should understand कि ये भी नहीं बोलना है, इसमें 0 marks मिलेगा अपने को, है ना? So MEN is a syndrome, NF2 is the like condition. Okay. Now, what is the screening protocol? Screening protocols में 2-3 things you have to answer. That MRI से screening, we do it with MRI. Screening start at 10 years of age. Okay, and you have to do MRI at 2-year interval for people who are under 20 years of age, and at 3-year interval people who are under 30 years of age. Okay, so just remember this protocol. They can very well answer you for 1, 2, 3 marks. Okay, so there is a criteria which is given in your Scott Brown by the name of Manchester's criteria. Just go through it once. Okay, these 2 images are given of your skin conditions which are associated. Just have a look. अपने दिमाग में एक बार छाप लेना. चलो, coming to this drug, bevacizumab. What is the mechanism of action? What are the uses in ENT? I'll tell you. At the end of this class, I'll tell you how we'll divide the OSCEs. There are around 8 to 10 subsections in which the OSCEs will be divided. Okay, so drugs is one of them. Drugs is important. You definitely get 1 to 2 drugs every time. Okay, so be prepared for it. Okay, so what is the mechanism of bevacizumab? I'll answer for you people. This is a VEGF inhibitor. Okay, don't forget it. Please make a note of it. And can somebody help me? What is the uses in ENT? एक answer मैंने बोला, एक answer please answer from your side. Anybody?
Juvenile recurrent respiratory papillomatosis.
JORRP. Good. Anybody else? कोई और? NF2. ठीक है? We studied NF2 just now. Okay, so don't forget NF2. Apart from that, there is something else called as recurrent laryngeal papillomatosis. Basically, it is another some like of your RRP only. But for filling your answer sheet, you can very well write it. Then you can also write as hereditary hemorrhagic telangiectasia. ठीक है? ये तो हो गया ENT का यूज. अब they can ask you for what condition was it approved? Now, ENT के लिए अप्रूव नहीं हुआ था ये. This was approved for FDA for colon cancer. ठीक है? So this can be a prospective question. They might ask it for a mark or half mark. For what thing it was actually used. चलो, coming ahead. This is again the third most favorite question. ठीक है? 2-3 times I've seen this question. This time also this was. ठीक है? Identify the instrument shown in the figure A, B, C. बाकी पढ़ेंगे. I'll write the answer for you. A is perforator.
Perforator.
Good. B is Larkin's hand burr.
Skitter.
Skitter. This is very important. ठीक है? Very important. And out of these 3, skitter is important. अगर एक ही पढ़ना है तो स्कीटर ही पढ़ना है. जैसे T3, T4, TSH में होता है ना, TSH is very important. ऐसे ही all 3 are important, but skeeter is most important of them. Now coming to this thing, name the surgical procedure where they are used. There's no fun in telling stapes surgery, stapectomy, stapectomy, वो सब बोल देंगे. Mention the no contact tool for the procedure. Can somebody take it? Laser. Very good. Very good. And last question. 4 intraoperative complication of this procedure. है ना? एक मैं बोलूंगा, बाकी 2 आप लोग बोलेंगे. I'll say कि CSF गशर. Can somebody increase it? एक दो और बताइए.
Sir, floating plate.
Good. Anything else?
Facial nerve injury. Facial nerve.
You can say like this, na? Facial nerve injury, injury to incus, tympanomeatal flap injury, all these things you can mention in this. Okay? Okay. Chalo, we'll move ahead. Over here, I'll again try to mention stapes surgery is very important. Okay? And again, a piece of advice to all you people. See, today there is no stress of exam. Okay, so you can revise easily, you can study easily, you can do many things easily. But believe me, there will be one fine day that your exam center will have come to a very different place. That is the beauty, or I'll say, I don't know what to say, of DNB. That suppose I did my PG from Delhi. And my center came to Mumbai. I didn't know anybody from there. So there will be one day for travel. You'll check into hotel, blah blah, all those things. So you'll lose the track of what to study. So please, I'll request you should make either if you want to save it in mobile phone, that is okay. If you want, you are traditional student, apna study table pe you want to make a stick it over there. Important topics. Number 2, topics which you are likely to forget, you should mention it over there. ठीक है, ताकि last 48 hours, 72 hours, when you are panicking, when you are in depression, you'll revise those topics. When there is a time कि अब मेरे को पढ़ना नहीं है, I don't want to study anything, I am lost. And that is the time when you have to revise stapes surgery. That is the time when you have to revise CSF rhinorrhea. All these things are very likely to be asked. चलो, let's move ahead. चलो भाई. हाँ. This is easy question. Identify the device. The name of this device is a threaded tapered screw. It's basically used for your trismus. Threaded tapered screw. ठीक है. And what are the grades of trismus? Basically, people follow it multiple. There are many sources which are available. Mild, moderate, severe. If the inter-incisor distance is 30 to 40 mm, this is 15 to 30 mm, moderate, or less than 15 mm, it is severe. People have also stipulated as your finger distance. Like if there are 3 fingers, that is mild, 2 finger, that is moderate, 1 finger, it is severe. So anything you can answer. Just remember the image once. Okay, these are 2 another images from the similar kind of thing which is available. Trismus mouth opening device. Okay, let me take you to this thing. Identify the names of the suture. Okay, so इसका नाम क्या है? Anybody can take it at a बोलो. Are you with me? मतलब my connection is not lost, I hope.
No, sir.
Okay. So this is your sternomental suture. This is basically done after your total laryngectomy or extensive pharyngeal resection, so that your neck remains in this lift. It shouldn't extend too much. If it extends, so there will be multiple other problem in the post-op period. So that's why you should remember it, sternomental suture. Now, again, somebody will like to take a try. Okay?
Tarabichi stitch.
Tarabichi stitch. Okay? Tarabichi stitch. So we all know where it is used in your one-hand endoscopic surgery. So this, Dr. Saab, just a minute. So this, remember this Dr. Saab's name, Dr. Muaz Tarabichi. Okay? And इनका नाम क्या है? You remember him? We saw it in the initial parts of the class. This is Dr. C. Kumar N. Patel. Please don't forget his name. Okay. So coming to the 9th question for the day. This image is for your contact and from your contact endoscopy chapter. See, there are multiple procedures we will study slowly. Believe me, I don't want to burden you guys with hundreds of PDFs in one single day. I have lots and lots of soft PDF and material. So if everything will get accumulated in your mobile tab and in your mind also. So the whole idea is to go slow and keep on absorbing it. You shouldn't forget it. आज contact endoscopy पढ़ रहे हो तो read it for the next 2-3 days में. You just read it once. It shouldn't happen that you read everything once. Contact endoscopy भी पढ़ लिया, OCT also you read, NBI also you read, and at the end of the day you forget what was the wavelength of NBI, which was superficial, which was deep. So getting my point. So you have to go a little bit slow so that you have to be easy on yourself. Don't burden on it. So what questions can be asked from this contact endoscopy thing? One thing is what magnification power does it give to you? It can give it to you 60x. It can give 150x. These are the two names which are mentioned in your Scott Brown. Okay. What dye is used in this thing? Can somebody take a try? Fresh from theory. Methylene blue. Okay. So now when you will read this contact endoscopy chapter, though it is of around 4-5 pages in Scott Brown, just go through it once, brush it once, see the images, and just remember these 3 points. You have to identify which investigation is given, one, and what questions can be asked. Apart from that, there can be uses which can be asked. There can be principle which can be asked. So that I'll tell you with that, basically what happens is the uses is that your papilloma of larynx, dysplasia of larynx, tumors of all those places can come. And what is the principle? Basically, you have to observe. It is a non-invasive approach, and you have to observe the microvascular network. And you like basically the cells of the superficial layers are stained, and then you see it through a microlaryngoscope. These are the 4 points which you should remember for contact endoscopy for your practical exam. Theoretically, you have to ratify it. For practical, you should know what can come in your question. Okay, so increasing your burden little further, what is field cancerization? Can somebody again give me help for this? This again I'll mention, this is very important question, likely to be asked. No? So I'll answer for you. This is also called as Slaughter et al. Hypothesis. Okay. So I'll tell you in some easy language. I'll share the PDF about it, what the entire article is about. To go through it aram se. What it mentions is, like supposedly a person who smokes, okay, so his whole aerodigestive tract is exposed to the smoke, right? From his oral cavity, larynx, hypopharynx, lungs, everything is exposed to the smoke. Now, because of this exposure, all this area is likely to develop cancer in the future further time. So this entire thing, in a very scientific or in a more I'll say fashionable way, this is called as field cancerization. Okay, so we'll go through this theory multiple number of times. The initial few classes will be to just put into your mind that this is important. You have to read more about it. Okay, this is not the end of the day. Okay, so please bookmark it. This is important question. What is field cancerization? What it is also called? It's called as Slaughter hypothesis. Okay, something else is also there. Yeah. Okay, just go through this image. I'll tell you what is the gundi in this thing. Okay, expand TAUS and what are the uses in ENT. So I'll just answer over here. The full form is
transoral ultrasonic surgery.
Yeah, transoral endoscopic ultrasound surgery. Okay. They can also tell you to identify what type of thing is going on. तब आपको बोलना है कि TAUS is going on. They are just telling you to see what image it is. There is setup of certain image and asking you simple question कि TAUS को expand कर दो, इसका number 1 ले लो. And uses in ENT, we all know कि it is used for lesions on tonsil, space of tongue, malignancy of your hypopharynx, larynx, all those things you can answer very well. Okay, यहाँ पे TAUS में there will be 2 more things which will come. One is your FK retractor is used in TAUS. So one thing for you guys is to see the image of FK retractor today. I'll send it to you, but एक बार खुद से देखना है. One, and second thing, there is something called as thunder beat, if I'm not wrong. Yeah. There is something called as thunder beat. Now thunder beat में क्या है? This is the ultrasonic scalpel which is used in your TAUS. Okay, so basically it cuts and coagulates at the same time, so therefore there is low heat and less thermal injury to the surrounding things. Okay, so then my main idea was today not to make the class very lengthy, because if everybody will get bored in the first class, so that is nuksan. So we'll go slowly. I'll tell you 2-3 things. One thing is your scientist, how to break off. One is scientist, second is boundaries, third is your abbreviations, fourth is your HPE, osteology, then there will be your important radiological sections. Radiological में 2-3 things. One is your NCCT PNS, there is HRCT TB, and there is certain MRI or CCT sections of your यहाँ पे आपका spaces of neck and thyroid malignancy. Okay, after this radiology के बाद आपका हो गया drugs. Then there is something in audiology for you. There's something in counseling. How will you counsel patients specific to certain things? And there is certain thing, some stages. What are the staging? There's certain classification, syndromes, multiple syndromes, and procedures. You know, like CVAMP, OVAMP, DICE, electromyography, all these things will come slowly. So this is mota around 8 to 10 things in which you can divide your studies and try to fully fill in between that. Like today we saw scientist में हमने आज 2 लोगों का नाम देखा है ना. So these things will come into a single PDF. I'll share it with you, but keep on revising the same way. That whenever you see the name of Dr. Muaz Tarabichi, you should remember his name. Whenever you see the name of Dr. C. Kumar N. Patel, you should remember his photo. You should remember the CO2 laser. You should remember that this is 10,600 nanometer. What is the uses of laser in ENT? 1, 2, 3, 4 खत्म. उसके बाद there is nothing left. Whenever you will see abbreviation, you should remember certain thing I heard something as Fiesta. There's certain thing I heard as RION, Rion, and associated things. So we will slowly build upon it. We'll build upon it. Okay, so over here I'll rest my case today. I don't want to engage you further. Just a minute, I'll stop this thing. 1 minute. Okay. So if now anything from your side, please let me know. Any input from your side or anything from your side, plus, minus, negative things, what extra we can incorporate, please let me know. Anything?
सर जो आपने वार्ड राउंड बताया उसमें exactly क्या होता है?
See, I'll share you my experience, first-hand experience, that I was able to manage that what all cases are present in the ward. Okay, so I came to know that there is a CA larynx patient over there, and so I made up my mind that my ward Viva will go on CA larynx, but they didn't took us to the क्या कहते हैं ward में लेकर के नहीं गए. They didn't took us to the ward and they made us sit in the aisle only, and they told us that there are patients in the ward. We'll not take you there. We'll tell you the data here. This was what happened with us. And believe me, what they answered, like before the Viva, I was reading everything about larynx. I was reading everything about TL, total laryngectomy, that my Viva is gonna go about here. And what I was asked is CA hypopharynx. And I don't feel ashamed to say I fluttered in that thing like anything because my mind was not made up. I was only answer which I answered was कि hypopharynx के parts क्या होते हैं. I'll leave about what was the management. Okay, so they generally what they do is they will have some patients in the ward. They might take you to the ward कि bedside लेके जाएंगे. They'll tell you कि evaluate the patient and tell us about this thing. This I saw in my hospital, like similar in ward Viva. There was a child of bilateral CI, cochlear implant. So that child was sitting with his mother, and the examiner was with his table over there, and when the residents came, they told he take 2 minutes, no need to talk with the patient, just observe him and then answer my questions. So these are the things that some patients will be there in ward. Based on those things, Viva will be there. But most commonly, this is like some common type of things. It shouldn't be very rare. ऐसा नहीं होगा कि तुमको एकदम rare tumor meningioma दे दिया और बोला कि इसको बताओ. नहीं, ऐसा नहीं हो सकता है ना. You will be given easier things which are routinely discussed in your wards. Okay. Anything else? Please shoot. Okay. We'll keep on meeting at regular intervals. I have tried to keep the days fixed, Tuesday and Friday. And in case there is some holiday or in case there is certain type of thing, so we'll try to prepone or postpone 1 day or prior. There is not an issue. Evenings, I'm totally free over here. I'm in a government setup, working in a government setup. Okay, so that's why I'm trying to utilize this time period for yourself also and for myself also. It's my revision. Otherwise, I will go blunt over here if I'll not read. Okay, and 2, 3 this thing, and third thing is your case discussions, है ना. Our main motive is कि यार मेरे को I'll do 100% in OSCE. Believe me, we will not be able to do 100% OSCE. 20 OSCEs, nobody does it correct. Okay, make up in your mind, in any practice, in any mock which you give, there are 5 bouncers which are there. Bouncers का मतलब होता है what happens in a bouncer, like when you play cricket, if it's a bouncer you have to duck. Okay, so similar kind of thing. There will be 5 questions. There is a possibility that you might not even know a single word about it. तुमको कुछ भी नहीं पता कि क्या पूछ रहा है मेरे को. So don't get disheartened. Next 15 questions are for you. 10 will be simple. You will sure go through that. For another 5 questions you have to read. Okay, and believe me, scoring 15 out of 20 questions is a very good score. Very good score. And for those 5 bouncers which are coming, if you are lucky, you would have read about it. It's not that it's coming from Mars. It's from your books only, but it is difficult too. And the important thing is your cave discussion. You have to focus on that. It cannot happen that you get 20 marks out of 100 in your cave discussion and you can make it up. It is simply not possible. Okay, so believe me, out of your 100 marks for your cave discussion, if you go 60 plus 70 तक पहुंच जाते हो, you have a very good scope कि अगर OSCE में तुम्हारा, like if you fall short of 5-10 marks also, if God forbid कि you are very unlucky and you are able to answer only 7-8 OSCE, it's very rare. I'll tell you, it's very rare, but you should think everything in your mind कि हाँ ऐसा भी हो सकता है, max to max bad thing that this can also happen. So your that 20 marks का जो तुम्हारा grace वहाँ पे तुमको मिल रहा है cave discussion में, that will sail you through. And most important thing, like I shared with you guys, the idea about DNB is हम लोग जो सोचते हैं ना, we'll read everything about, this is not done. For DNB, you have to read something about everything. तुमको कुछ पता होना चाहिए सबका. ऐसा नहीं होना चाहिए कि you lost. सर ये तो मैंने कभी सुना ही नहीं ना. You have to listen. You have to know 1 or 2 points about it. Theory is over now. You have to work in a focused way for a practical things. Okay. I'll keep trying to interact you with in these things, and Tuesday or Friday definitely we'll meet for these classes, and we'll go in a planned way, है ना. Revise it accordingly. अभी अगला 2 दिन है, lasers revise करना है वापस से. Revise your acoustic schwannoma, vestibular schwannoma with that, है ना. With another question, revise your drugs, whatever you have seen. Try making your list. Try making your notes. It's very helpful. Whatever you want to make notes in your iPad, that's fair enough. Or if you want to make in a hard copy, that is fair enough. आखिरी दिन you can take your copy along with you in the center. उसके लिए iPad के लिए थोड़ा सा मुश्किल होगा, है ना. So think accordingly. You can carry your iPad also, but main exam में थोड़ा सा मुश्किल होता है. ठीक है, we'll help you out with what all to take, what all not to take, all those things. अभी वो it is another 2-3 months का game है. Your focus should be to read at least 15-30 minutes, half an hour, 1 hour daily. It shouldn't happen कि I'll wait for my exam, then I'll start reading. Believe me, the main problem about DNB is थ्योरी एग्जाम होता है, उसके 3 से 4 महीने बाद प्रैक्टिकल होता है, एंड एवरीथिंग इज आस्क्ड दैट इज थ्योरी ओनली. ऐसा नहीं है कि वहां पे तुमसे they'll tell you something कि प्रैक्टिकल करके दिखाओ. नो, एवरीथिंग इज थ्योरी. सो यू फॉरगेट इन अनदर 3 months 4 months में सब भूल जाता है. So please don't let it get rusted. Try brushing through it. Okay, that is the main motto. And any problem, I'm just a message away, just a call away. Not an issue. I don't have any problem with that thing. And keep on reading. Any problem, please let me know. Any constructive or any negative comments also, please drop me a message. Not an issue. We'll try to incorporate each of others' problem. And आपके अगर if you have some weak topics like you have कि मेरे को इसमें दिक्कत है, so we will read about it. We will go about it. And one more thing I just wanted to tell you, that please don't go into details of everything. Like what happened कि like there are certain questions की VAMP है ना. If you have done VAMP in your VAMP or VNG in your residency days, then it's easy for you. But if you have not done a single VNG, single VAMP in your residency days, and you think कि आपको 2 हफ्ते में you will read how this VNG is done, so that is not fair. Okay, so don't put entire pressure in your mind. That is fair enough. Okay, so if there is nothing, no point from your side, we'll call it a day and meet again on Friday. Okay, chalo, see you guys.